Regional One Health is going to great lengths so you can receive exceptional medical care without increasing your risk of exposure to COVID-19. So if you need to see your provider in person, you'll get the same level of care. And whenever we can, we're using technology to create a contact-free patient experience. And that even includes a new curbside pharmacy service. We are confident we can provide exceptional care in a safe environment because at Regional One Health, your life is our passion.
Good afternoon. Welcome to our second episode in our series, We Are One Live. And today's topic is COVID-19 vaccines and race. I am Tammy Ritchie. I am the Chief Development Officer for Regional One Health Foundation. I have the privilege of working with the great people that are going to be part of our panel today. And I would like to thank you for taking time out of your schedule to watch us. I am going to begin by introducing our panelists. I'm going to start with our wonderful DRC. DRC, are you there? Hello, DRC. How are you?
Hey, Tammy. How are you?
I'm great. Everyone, this is DRC DeVoe. He's the senior pastor for Emmanuel Missionary Baptist Church. He is also one of our beloved staff chaplains here at Regional One Health, and he joins us from his office. Next, I have our wonderful director for the Center for Information and Analytics, Niranjani Radhakrishna. We also call her Jani. Hello, Jani. How are you?
I'm good. How are you?
I'm wonderful. It's nice to see you today.
Thank you.
I am going to bring in Dr. Cyrlyn Walters, who is making her return day. Hello, Dr. Walters.
Hi, everyone.
Dr. Walters is the Medical Director of Ambulatory Services for Regional One Health. And then I am going to introduce Charles Lapsley. Charles, are you there? Hi, Charles.
Hello, Tammy. Hello, everyone. How are you?
I'm doing wonderful. Charles is the basically director of nursing for everything, I think. He's the director of nursing for trauma, for emergency services, for critical care, for burn center. Charles wears a lot of hats around here, but he is joining us today to help us have this very important conversation. I also would like to introduce our president and CEO, Dr. Reginald Coopwood. He is not going to be part of the panel today, but he is in his office and said he did want to pop in and share some words today and speak to everyone. So I'm going to kick it over to him so he can start our discussion today. Dr. Coopwood?
Thanks, Tammy. And thanks to each one of you all for tuning in today's session. And a very special thanks to our expert panelists. We all want to get to a place again where we can travel and visit friends, hang out in a room without a mask and greet people and hug and even shake hands. I bet your family is not much different from ours. It's been hard for our kids not to be able to spend time with their grandmother and hug her. Even though my Titans didn't make it to the Super Bowl, it wasn't the same. No parties, no being around friends and cheering and hooping and hollering like we usually do for this big game. If you're anything like me, you're zoomed out. We want to get back to the point where we can have in-person meetings where we're sitting face to face and having dialogue and interacting like we normally do. It doesn't have to be much longer. We can get back to doing the things that we love. The quickest way to get past this pandemic is to use all the tools that we have to defend and defeat COVID. We know with 100% certainty that the tools that we have, hand washing, wearing a mask, and social distancing, is important to reduce the spread of COVID-19. Now we have a very powerful tool, the vaccine. I think the best way to show your family that you love them is to get the vaccine and to honor people who have died, some of them that we all know. I trust the people on this panel. I trust the vaccines that are available to us. I want to invite you to, when you have the opportunity, roll up your sleeve and get the vaccine. Thanks to Dr. Walters, Charles, DRC, and Janie. You're a great part of our team. Back to you, Tammy.
Thank you, Dr. Coopwood. We appreciate that. And before we go further, I would like to remind everyone watching, we are amateur moderators and panelists here. So you will see me referring to my notes. You may see some of our panelists referring to their notes. We just want to bring this information to you to help you make good decisions for your family. So I'm going to start actually with Janie. I'd like to talk a little bit about why this topic is so important and vital to our community. There are a lot of stories right now in the media, Janie, about the low numbers of Black Americans who are getting the vaccine. And what we would like to know is, as our data expert, can you tell us, is this true? What does the data say?
Well, thank you, Tammy, and thanks for having me today. So I want to walk you all through some of the data that we've seen in the media. So we actually have some data here that's ready for you. And so the first thing here is this data is actually as of Friday. So you can get this data actually right off the tennessee.gov website. All of the data is completely downloadable for you. So from this data here, and this is the data that we have that race was reported for, that you can see that 27% of people who've received the COVID-19 vaccine identify as Black or African American versus 46% who identify as white. You can also see here that we have 12% who are unknown, meaning that they, at whatever reason, the race was not reported. Maybe they chose not to, or at the time that they received their vaccine, race information was not collected. So this is actually about 11,000 people. So it's very possible that Black Americans are not receiving the vaccine as much compared to white Americans. And especially when we look at compared to our total Shelby County demographics, which I have that data for you as well, okay. White people make up 39% of Shelby County, and Black and African American people make up 54% of Shelby County. So you can see that the percentages here definitely may indicate that, but it's hard to make that assumption directly looking from this data because we do have 11,000 people that we don't have racial data for. But that being said, as much as I love data, I'm the director of data and information, there's limitations around what data can show us. And racism is something that numerically is hard to show. So I'm going to actually turn it over to Dr. Walters, who can tell you more of that story that we can't necessarily see from the numbers.
Thank you.
Yes. And so as Janie so eloquently said, you know, we have that information. And even with that information right now, although we're not accounting for 11,000, we're still seeing that we have a lot more percentage of our Caucasian population that have gotten vaccinations so far. And so we know that, you know, not only are we getting less vaccinated, but there's another part to it. You have to look at what percentage of African Americans are getting COVID. And so if our percentages are abnormally high in comparison to what percentage we are in the population, and we're getting vaccinated at around 20-something%, then we know that we're lagging a little behind. And when we talk about health equity and racism in healthcare, one of the things that you want to do is you want to have the person that's been behind to have a little jump start. which would mean that our vaccinations should be higher than what our population, what percentage of the population we are, and what percentage of the cases we are. And we know, we've seen it in the news so far, that the reason you've heard many times, the reason that we haven't gotten vaccinated is the hesitancy in the vaccine for multiple different reasons, from historical perspective, from this drug being new, and also the distribution of the vaccination and where it goes. So we know that numbers help, but we also have to look at it from different perspectives to kind of tell a whole story.
Thank you. DRC, I'm curious, does this mirror what you're seeing in your community? And in your opinion, why do you think there may be more hesitancy among members of the Black community to receive a COVID vaccine?
Well, thanks so much, Tammy. One of the first things that I've noticed is that we started out with the assumption that they had to convince African Americans to take the actual shot. And once you start with having to convince somebody to do something, that's the wrong approach. And then in order to get the COVID-19 vaccine right, we must close the confidence gap. And we must lose that, what I'd like to call pathologizing of communities of color. When we think about the discussion of most African Americans are skeptical as to how are they thinking of us? What are they thinking? Because we think about such things as the Tuskegee experiment and the early 20th century forced sterilization. And what that did was, because there's a lack of trust, now the African American community is saying, what should we trust from you? And then, of course, you go from trust to, as we age, we become begrudged from situations that we've not gotten over. Because, see, marginalization is not a passive process. And communities have been actively disenfranchised by policies created to enforce rather to include. And so the African American community is now saying, I don't feel included. I feel forced on, and I feel as a second thought, because that level of distrust has kind of become overwhelmed. And now there's a lack of confidence. And the behavior is now, am I thinking of African Americans before, during, or after? And so we lose confidence. The community lose confidence because we feel like, as a people of color, we're an afterthought. As a people of color, you think about us later, but yet still you'd use things like the HIV and AIDS pandemic in the late 1981. And that is what the community is looking at now and saying, if this is what you did to us, how should I trust you now?
Thank you. Charles, I know you and I, and you've been very open with members of this panel just about your own experiences, and what DRC was saying kind of resonates and reminds me of the things that you and I have talked about. Would you be willing to share, like, do DRC's comments resonate with you, and what type of issues did you have personally with the vaccine rollout?
Okay, thanks, Tammy. Tammy, unfortunately, it does resonate with me. I think about my elderly parents. My mother's 76, my father's 80, attempting to register online for vaccinations without the help of their children, who thankfully are medical professionals. Early on, the platforms were all digital. They require internet service and also the ability to navigate the internet. The bottom line is, several impoverished people do not have the internet. As the RC shared, marginalization of Blacks have led to a disadvantage related to health and accessibility. Also, high percentages of Blacks are frontline essential employees that cannot take off work to miss pay to stand in lines for the allotted slots that were available. Efforts must include key stakeholders at the community level to ensure that vaccinations are reaching the intended recipients. More recently, we have seen community involvement, whereas vaccinations are occurring at churches and in the community setting, and that's a move in the right direction.
Thank you very much for your vulnerability and for sharing this with us. I know it unfortunately resonates with a lot of people. Dr. Walters mentioned vaccine safety a little while ago, and I think that has been something that across the board I've heard people talk about How can this vaccine be safe given how quickly it came to market? I'd like to turn again to Janny, and let's just have a conversation. Let's start our conversation about vaccine safety. Janny, can you share with us how many people in the United States have died from the vaccines?
I can, and I have good news for you in that number is 0. But I do want to acknowledge the numbers that people might be seeing in the media and around to indicate maybe why they're not seeing 0. So to provide some clarity on that. So there have been over 63 million doses of the vaccine that have been administered in the U.S. From December 14th, and I think the data I have is Saturday of last week, so February 21st. And during this time, there have been 1,099 reports of death of people who did receive the COVID-19 vaccine. But every single one of these deaths was investigated by CDC and FDA physicians, and not a single one of them was attributed to the vaccine. So there might have been an underlying condition. And in fact, it could have been one of the reasons that the person was actually eligible to get a COVID-19 vaccine. Something else led to that person dying, but they did happen to fall into that group that did receive the vaccine. So again, that number is 1,099. And even of those deaths, that's only 0.0015% of those reported deaths.
And can you tell me again how many vaccines have been given?
63 million doses.
Amazing. That's amazing. So can you tell me now how many people in the U.S. have died of COVID?
Yes, and that number is unfortunately not 0. So this data here shows us that the U.S. People who have died and that cause has been attributed directly to COVID-19 is over 500,000. And that's about 20% of the deaths that we're seeing worldwide. So compared to deaths from the vaccine, where 0 of them have been attributed to the vaccine, over 500,000 deaths have been attributed to COVID-19 in the United States.
Wow. Thank you very much. I'd like to ask Dr. Walters a question about the vaccine going to market. A lot of community members that we requested that people send in their questions, and many people said that their primary concern is the speed at which the vaccines were produced. So will you please share with us what you know about the process to market, and does the speed at which they were developed mean they are not as safe?
Okay. And so this is a very good question because, at the beginning of the pandemic, when we were talking about social distancing and wearing our masks, one of the reasons that we said that was so important was that vaccines take 5, 10, 15 years to develop and that we couldn't rely on a vaccine for COVID-19 during this pandemic. One of the things that is amazing, though, is when we have something that's gripping our communities worldwide, it's amazing how things come together and how we support each other. So there are 3 different parts to why this vaccine was made so quickly or appears to be made so quickly. One is the Moderna and Pfizer vaccines, which are the mRNA. And we just got approval for Johnson & Johnson. So now we have a 3rd vaccine in the US. But the mRNA vaccinations, that science of developing that mRNA was done from about 10, 15 years ago when we had the original SARS epidemic in China that we thought would be a pandemic. So they started creating a vaccination then and had that technology. Of course, this COVID-19, which is SARS-CoV-2, is so similar to that original SARS that they were able to use that research and build upon it. Okay. The second part is when you have many hands make light work. So when you usually have one lab where you might have 2 or 3 scientists kind of working on studies, now we have a conglomerate of multiple labs, multiple scientists sharing information. And because of the multiplication of everyone really focusing and working on this, we were able to get things a whole lot quicker than you would if I was here and then someone was in the UK doing something totally different and we were working on our own timeline. The third part of it is with that increase in sharing and science, we also had an increase in money. We had an increase in money to be able to develop it, for it to go from research to presentation to the community really quickly. And then the last part is the phases. So when we do vaccine studies, we start with a preclinical where we try to figure out, hey, what formulation we're going to use. Then you have phases 1 through 3. Phase 1 is usually a small group where you're trying to figure out how much dosage, what works, those types of things. Then you have phase 2 where it expands and you may have more people to see kind of side effects. And then phase 3 is usually the biggest. And those are the results that we saw with the vaccines when they came out, where it's 30 to 40,000 people, a large age range, people who are healthy and not healthy, people who are exposed or not exposed to COVID. And what happened with this vaccination is that we were able to put those phases on top of each other, stacked, rather than doing one separately, awaiting the results and then going to the other. So those are the reasons, some of the reasons why these vaccinations were developed so much quicker than before.
Okay, that makes a lot of sense. And as someone in philanthropy, I know that money can speed up a lot of things. So that personally hits home.
Yes.
Can you, right now, I mean, I know Johnson & Johnson got approved, but right now what our community is receiving are Moderna and Pfizer vaccines. We did have several people send in questions wanting to know if one of those vaccines is better for people of color.
There is really no difference with the two. I tell my patients and everyone who asks, the best vaccine is the one that you have access to. And so basically Moderna and Pfizer are the difference between having Nike and Adidas. They're still tennis shoes. You still can wear them. They still may do the job. People who are diehard Nike fans will tell you otherwise. And it's the same thing with Android and Apple. And so they're so similar in terms of the studies, in terms of the representation when they did the studies, in terms of the side effects, in terms of the 2-part dosing, and in terms of the effectiveness, they're almost interchangeable. There are some minor differences with how many people they saw with some side effects versus others. But when you look at Pfizer and Moderna, they're essentially interchangeable, and it's whichever one your community is giving you.
Okay, thank you very much. Charles, I'm going to switch to you for just a minute. When the media says that people of color are dying from COVID at a higher rate than others, does that mean that your race determines your outcome?
Okay, Tammy, the simple answer is no. Your conditions determine your health outcomes. Let's be real. Racism has created systems that make it exponentially harder for Black and brown people to be healthy. However, with that being said, it's your comorbidities or your underlying health that allow COVID to run rampant in our bodies. Our white brothers and sisters, they suffer equally when they have pre-existing respiratory, renal, and congestive failure. These are issues that potentiate the disease of COVID. So again, being Black or white doesn't make a difference. It's all about your underlying conditions.
Right. Thank you. Very clear and to the point, and that is exactly what our viewers want. I do hear that we had some questions that are coming in, so I want to just interrupt and say, if you have questions that you would like to ask our panelists, please type them in the chat box, and we'll get to them at the end of our discussion. Dr. Walters, talking about, I think Charles mentioned side effects. I'm going to ask, do you know what is the percentage of people who have adverse reactions to the vaccines?
Okay, so let's talk about like the common reactions that you hear. And the first one is soreness at the injection site. So with both Moderna and Pfizer, that percentage can be anywhere from 70 to 90%. It goes up a little by your second dose. And that is because your body is already primed. So your body's primed with your antibodies. And so by the time you get the second dose, you have a quicker response from your immune system. That is what you want your body to do. I hear it all the time when people say, I don't take the flu shot because the flu shot gives me the flu. Well, it's not that it gave you the flu. What it is your body's immune response, which is a multitude of different parts that try to keep foreign bodies out of your system. And so fever, soreness, those are the things that you see when you get vaccinations. So the injection site is the most common. I think the next most common after that is fatigue and headaches.
Mhm.
And then you have some people that have had body aches and chills, and then a smaller percentage with fevers.
And among your patients, is there a difference in side effects among races? Or are you seeing most everybody has the same side effects?
Everyone pretty much has the same side effect. Almost 9 out of 10 people I hear had the arm soreness, and then a smaller percentage would have, but it does not vary based on race.
Okay. Charles, I know you work around a lot of people. Does this mirror what you're seeing just in terms of side effects among your patients and your colleagues?
Yes, it certainly does. I personally received the shot. The first shot, no pain, no nothing. When I got the second shot, I had some tenderness, and it felt like maybe I had gotten a tetanus shot. So it was sore for probably 5 or 6 hours. The most I've heard or seen amongst my staff has been what Dr. Walters referred to as the localized shoulder pain at the injection site. We've had some report some fevers for less than 24 hours, and then what we call a little gripe, a little belly gripe, or a little grogginess, and that's been it.
DRC, I'll ask you the same question. Is this mirroring what you're hearing from your parishioners or from the from the colleagues that work at Regional Health with you?
Yes, Tammy, that's exactly the same. And the one thing that Charles just mentioned was the stomach grogginess. That was something that I've been hearing a lot of, but the arm soreness was one that kind of stood on top of everything else. And when somebody mentioned the stomach grogginess, I was like, okay, let's see if we hear this again. And so I heard it once, twice, maybe 3 times. And it's like, okay, so you add that to the compilation of all the other things that they're talking about. But one thing that we have to look at as we talk to our people is remind them, always remember your pre-existing conditions will determine the effects of this vaccine. So many times people will get the vaccine and suddenly they have 30 things wrong with them that they knew that they always had wrong, but suddenly it's the vaccine. And so we always try to remind them, please, whatever you do, make sure that you understand your pre-existing conditions and don't use the COVID-19 shot to slander it and discourage other people from taking the shot, but rather be sure you know your health condition first.
Thank you. And that's very true. I'm the same way. I had arm soreness. It felt like someone had hit me in the arm. And then the next day I had fatigue. But then I had to do what DRC said, is think, okay, am I really tired from this shot? Or am I really tired because I know I did not sleep last night? And for me, so I'm going to say it was because I didn't get a good night's sleep. But my symptoms were the same with both the first dose and the second dose. Dr. Walters, I would like to ask you about the actual vaccine. We had several people send in questions, and I'm going to read this here. Please tell us, is the coronavirus in the vaccine? And I know you touched on this earlier, but people want to know, if it's not in the vaccine, why are they having an immune response?
Okay, so that's a very good question. And it pretty much comes into how the vaccines work. And so the simple answer is absolutely not. None of these vaccines have the coronavirus in them. So our mRNA vaccine, and I'll add a little bit about the Johnson & Johnson, the goal is to induce an immune response. So we are trying to get you to have some arm soreness or something so that your body is responding. What they did is that there is the spike protein on that coronavirus, and that protein is basically the key that lets that virus into your body so it can take over your cells and replicate and cause the damage that it does. Okay. So when they were looking for which part of this virus can we get our immune system to respond to, that spike protein was the best option because it stops the virus from getting into your cells to begin with. or that was the goal. So with the mRNA vaccines, what they do is they took that messenger RNA, which is basically like a ticket when you go to the when you go to the restaurant and you order your food, and the attendant writes what you want and they send it to the kitchen. mRNA is basically that ticket with your order for your food, and the kitchen is your cells in the ribosomes. So those mRNA vaccines, they get that information in. Once that information it tells your body to make that spike protein. Once that's made, your body says, wait, that does not belong to me. That is something foreign. And that's how it induces that immune reaction. With the Johnson & Johnson, it's a similar process, except they took an adenovirus, which is a virus that causes the cold. They make sure they took off all the parts. So, you get a car and you take off all the parts and you just add the part that you need. So they take off all the parts that were able to make you sick, and they were able to get that protein in, and that will be basically the vehicle that gets that protein into your body. Again, your body sees that protein, understands that it's foreign, and it starts to make this whole immune response. So that's why you have the adverse reactions, but it's completely not the virus at all.
Okay, thank you very much. Now, Charles, let's say I have gotten both doses of the vaccine. Does that mean that I can just go live my best life and not wear a mask and not social distance? Or what precautions am I going to have to continue to take after I've been fully vaccinated? How do I stay safe?
Tammy, we all want to live our best lives. But unfortunately, we still need to wear a mask. Until we know more, we will need to continue wearing our mask, washing our hands, and socially distancing. And I know, trust me, this can be very hard. Visiting friends, say for instance, you live in a multi-generational home where elderly people are there. We have to have crucial conversations. My kids are young, 7-year-old, 12-year-old, but daddy had to sit down and have a sincere, crucial conversation with them that if you're not washing your hands and wearing your mask, you could be the cause of grandmother and granddad leaving here early. And that's a hard conversation, but it's one that must be had. And that's the only way we'll continue to be safe. We must continue to keep our guard up.
Okay, very good. So if I go and I have to run an errand, I'm putting my mask on, even if I've been vaccinated. And when I come back home, I am washing my hands and making sure I stay distant and that I am not getting in everyone's space at my house. Correct?
That's right. Correct.
Okay, very good. We actually have a really exciting thing that happened today with Shelby County schools going back in person. I would like to ask Dr. Walters, now that the teachers are being vaccinated, what impact do you think that is going to have on COVID in African American communities?
It's huge. It's important. One of the things is we can't vaccinate our children right now because the studies originally were not done to include children. There are new studies that are coming out where they're going to younger ages, but we don't have those results yet. So I don't suspect that our kids are going to be vaccinated. By having the teachers vaccinated, however, then we stop and reduce that transmission from kids to teachers, teacher to teacher, and then teacher to community, to grandma, to baby cousin. In those, as Charles mentioned, we live in kind of multi-generational houses. And so by having that group, and teachers tend to be kind of a younger demographic. So if we waited until we got to the phase, they would not get vaccinated till later in the summer. So by pushing them up, we're stopping that transmission that we would have potentially with the interactions with students and teacher to teacher while they're at school.
Thank you. I'm going to stay with you for a second, if you don't mind. I would also like to ask, are the current vaccines effective against all of the variant strains that we keep reading about? And I have a feeling that every day is going to bring a new variant strain, similar to the flu season, where we take our flu shot, but then 2 weeks later, it's a different strain. So
yes.
It is. So what we have currently is effective?
What we have currently is effective. And one of the things I want to plug with Johnson & Johnson is actually when they did their trials in the US, in Latin America, and in South Africa. And that was part of the reasons they expanded their trial to those countries, because we know that there is a different strain in South Africa and one in Brazil. And what we did find is that that vaccine was still very effective against preventing severe disease with those strains. And we know that Moderna and Pfizer as well.
Excellent. That's very exciting to know. In your professional opinion, I'm going to ask Dr. Walters this, and then I'll ask Charles. In your professional opinion, is the vaccine worse than the virus, or is the virus worse than the vaccine?
Absolutely not. And I can say this with just everything that I see. I mean, I have a post-COVID clinic, and one of the things that we hear about all the time is the severe disease and the people dying from COVID. But I will tell you that I see way more patients who have survived COVID, never got into the hospital, and they're struggling right now. So COVID-19 is so much more than, hey, you're gonna live or die. And except for the arm soreness and maybe feeling like crap for 24 to 48 hours after the vaccination, that is all that I have heard so far about the vaccination itself.
Charles, same question to you. In your professional opinion, is the vaccine worse than the virus?
To me, it's a no-brainer. Janie did a great job with the data, and we saw that 0 deaths were related to actually being vaccinated. Okay. And just being on the units, actually seeing the death associated with this vicious disease, it's a no-brainer for me. There's no way a simple arm soreness or grogginess could compare to what I've seen and the death that I've seen related to COVID.
DRC, what is your response when you hear colleagues or maybe some of your parishioners at your church say that they're going to wait until after the first year of vaccines before getting one?
Tammy, one of the first things I remind them of is that vaccination is one of the best ways to eliminate any pandemic and for us to go back to some degree of normalcy. The other reminder is to look at how if they delay it, they can be the person that's infected and they can be dangerous to the people around them. Yeah. And whilst it might be cliche, we trust the scientists trust the preacher. So we exercise faith over fear. We are not afraid to go in and take the shot because we believe that the scientist was enabled with a level of learning that as believers we must trust, and we can't decide when we're going to trust the physician. We have to trust them all the time. So our push is you cannot afford to be hesitant because you might be a carrier, and for the people you touch you can hurt them, and as Charles said, you can cause some people to check out of here sooner than later. And one of our words of encouragement is the sooner you get the vaccine, the sooner the people around you are safe, because really you might think it's for you, but it's really for your mom, for your dad, for those people around you so that they can be safe.
Thank you. And I heard recently, it was another one of your chaplains who made a comment about getting the vaccine was something that she did in honor of the people that she had already lost. It was not available for her family members who had already passed away from COVID, but it's available to her. So she was going to make sure she got it. So yeah. Your teammates are listening, and they're doing an awesome job. I'm going to go from vaccine safety now to talk about some very common myths. And I will let you know I did not come up with these on my own. These were sent in to us from donors and stakeholders and community members and others, even employees. And I'm going to go to Dr. Walters. At this time, you tell me, is this a myth or a fact? At this time, do the vaccines cause any fertility or sterility issues?
That is a myth. Okay. And I know where this came from. There was some reports going out about the protein for the for the virus being similar to another protein that's found in placenta. And there has been no studies to show that there is a cross reaction once you have antibodies to the protein from the virus. So that is absolutely a myth.
Okay, thank you. Thank you for that information. DRC, African Americans are receiving a placebo and not the actual vaccine. Is that a myth or a fact?
Tammy, that's a myth. The vaccination is not a figment of the imagination. The shot is real. It is very real. The vaccination is real. And I'm a proud carrier of a card that says I got 2 shots of a real shot. So I know it's real.
Thank you. Charles, here's another one. Is this myth or is this fact? There are 2 different forms of the vaccine. One that is being given to Black communities and one that is being given to white communities.
Okay, Tammy, that's a myth. For this to be true, there would have to be a covert operation going on with all vaccinators all over the country and the world coming together to give the Blacks a different vaccination. So it's a myth.
Thank you. And I will say, when I received my vaccine here at Regional One Health with other healthcare professionals and frontline workers, it was a very diverse group of people, and we were all super excited to be in that room. And every one of us had lined up with our sleeves rolled up, and we all received vaccines from the same vial. So it was shared among us. Now, DRC. This one was odd to me, but I think you may know where this comes from. But we did have someone send in wanting to know if this is a myth or a fact, that you can microwave your mail to kill the coronavirus. And you told me at one point this had to do with heat.
Yes, from what I understand, heat kills the virus. But please, sir, please, ma'am, please, community, please do not microwave your mail.
Thank you.
It's not safe.
That's correct. Well, if they want to, they can microwave it, but it's not going to keep you from getting COVID.
It's not. And then there's some underlying stuff, some envelopes have foil in it. It can cause a fire. Right. And next thing, that could turn into something else. So please.
That's right. No, we don't want any more customers at the burn center. DRC. I'll stay with you. The vaccine has been designed to infect communities of color. Myth or fact?
That's a myth, Tammy. And the reason why we can factualize that is because you have all races, all genders, all communities infected with the virus. And as a result of that, we are all affected equally. There is no one symptoms for Asians. There's no one symptoms for African Americans. If you're having cold chills, everybody's having cold chills. If you're having a fever, everybody's having a cold fever. And what has happened is that some communities are holding on to so much bad data from history that they're not willing to let go and move forward. Wow. They're holding on to the data that says somebody did this to somebody a long time ago, and now I'm afraid to trust. In our society today, if we're going to move forward, we have to, one, trust the people that we serve, and then secondly, trust the people we serve with. And if we're going to move forward, we must be sure that we are trusting each other and saying, this is not a Black disease, this is not a white disease, it's a disease. It's not one shot for African Americans and one shot for Caucasians. It's one shot. And we must get out of this, and it's harsh to say, but that ignorant thinking that says this is going to happen to them, but not to us. The struggle is, let's make everything available to everyone at the same time. Let's not put one group further behind than the other, but let's make sure that everything is available to everyone. Thank you.
And Charles, I'm going to end with this last one, since you are one of our younger members on the panel. Does COVID only affect old people?
Unfortunately, Tammy, this is just not true. COVID has affected several young individuals, 35-year-olds, 40-years-olds. Things have been in the media. I have a cousin in Atlanta Several young individuals are actually dying and losing their life to this vicious disease. So that is a myth.
Okay, thank you. I would like to go to Janny just for a few minutes. I think something that DRC said and everyone said is so important is about having credible and reliable information. And this changes all of the time because this disease changes and because we are still learning as we go. We have never faced a global pandemic like this. So Janny, can you please share with us where people can go to get some information about COVID-19, the vaccines, the variant strains?
Absolutely. I love talking about data, and I think data is very important to tell our story. It's a very big part of it. I also, before I share the data, I just also want to just say, trusting the recommendations and perspectives of Black leaders and experts like who we have on our panel is also a very big part of that story, especially to get to that side that we may not be able to see from numerical numbers just because of that limitation of what information is collected. But that being said, if you are wanting to learn more about the data that's out there, I do have some recommendations. Now, the media is great for taking some of these sources and bringing them to us in a way that's a little bit more easy to understand and makes it a little bit more digestible. But sometimes facts and statistics can be misconstrued or taken out of context. So if you do see something in an article or a blog post or a social media post, I encourage you to take that statistic and follow it to the root source. And some of my favorite root sources, I actually use these today to share some information with you all. I mentioned tennessee.gov. So tennessee.gov has information for all of the counties in Tennessee. And I mentioned that the data sets are actually downloadable. So if you are savvy and want to play around with the data yourself, you have that option to do so. So tennessee.gov. Another one is Shelby County. Shelby County actually has a digital dashboard that updates daily to weekly, and it's a very fun interactive tool. I think it's fun. I'm sure others out there might have fun playing with it as well, but that's out there again for everyone to see as well. And then the World Health Organization, that's where I got the information about worldwide statistics compared to the United States. Again, another interactive dashboard. And then two other interactive dashboards and also just information about COVID, the vaccines, the strains, anything you want to know. Johns Hopkins and the CDC, great information and great institutions to follow as well.
Okay, thank you very much. And we are actually, just so that you know, this video is going to be archived on our YouTube channel. So if you do not subscribe, please do so. It's Regional One Health. We will put the links down below so that you can click on any of these links in the future or share them with your peers, your coworkers, family members. And I'm going to actually start talking a little bit about the availability and accessibility. That's something we've touched on today. I would like to ask Janny, do you know who is currently eligible for a COVID-19 vaccine in Shelby County? And where in Shelby County can they go?
Yes, I know this answer, and I can also give you all some resources to where you can also call and follow up with more information as well. So for Shelby County, if you are 65 and older, teachers, childcare staff, first responder, operations personnel, and then individuals in the 1A1, 1A2, and 1B can schedule vaccination appointments. And there's actually a phone number that's available 8 a.m. to 4:30 p.m. So for folks who maybe don't have access to internet or computer, you can always call this number. It's 901-222-7468. And the 7468 spell the word SHOT. So it's 901-222-SHOT. And you can call that between 8 a.m. and 4:30 p.m. And if you do have access to a computer or an internet or a mobile device with internet, you can go to covid19.memphistennessee.gov and you'll find all of this information there as well.
Okay, that's excellent. Thank you very much. I do believe we also are going to show on the screen either now or at the end of the program some locations where you can get your doses. But like Janny said, you can call that number and you can tell them where you live and they can let you know what site is near you. Or if you do have internet access, you can certainly go online and do it as well. We have a question that came in that I would like to ask. I'm going to direct it to Dr. Walters. And I don't know if you know this, I'm catching you totally off guard here. But one of the questions is, when can we in Shelby County expect to see the Johnson & Johnson vaccine available for us?
That I do not know the answer to, because the state determines who gets the vaccination. I know we had a priority for Pfizer, and so now that Johnson & Johnson has been out, we will be able to tell based on the state how much are they going to give to the Mid-South, to West Tennessee, to East Tennessee. They're the ones that drive who gets what when.
Okay, now I'm going to ask, should I wait to get the Johnson & Johnson?
Absolutely not. If you have the ability to get a shot, go ahead and get that vaccination. Because even if you got one of the Pfizer or Moderna shots, you're still more protected than if you got none and run that risk, especially with these more contagious mutations and variants out. If you have that ability, go ahead and get the shot. You don't want to wait and then be the unlucky person that got COVID-19 during the time you were waiting.
Thank you very much. I definitely appreciate that. I just wanted to reiterate it for everyone that's listening. I want to personally thank each and every one of our experts. I will say personally, I love working with all of the men and women you see on the screen right now. They are the top in their fields. I trust them dearly. My family trusts them and their advice and their experience. I don't think I work with a better group of people than those I work with at Regional One Health. If you heard something today that really pulled at your heart and you would like to make a donation to the work that's being done by the men and women you see on this panel and 2,900 others, there is a text to give number on the screen. And again, if you would like to share what you saw today with members of your family, friends, this will be archived on our YouTube channel, Regional One Health. Subscribe to it and you'll get our next episode when it gets ready to air. And again, thank you all very much to Janny and Dr. Walters and DRC and Charles. Y'all just did a wonderful job. And I hope that those watching got some information that will help you make good decisions for the health of you and your family. So thank you all, and we will see you again.
Regional One Health is going to great lengths so you can receive exceptional medical care without increasing your risk of exposure to COVID-19. So if you need to see your provider in person, you'll get the same level of care. And whenever we can, we're using technology to create a contact-free patient experience. And that even includes a new curbside pharmacy service. We are confident we can provide exceptional care in a safe environment because at Regional One Health, your life is our passion.